Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Candidiasis. The most common organism causing candidiasis is Candida albicans, which is a fungus. The chief complaint of candidiasis is pruritus. Other symptoms include scanty discharge, splash dysuria, dyspareunia are generally absent. The discharge of candidiasis includes curdy white or cottage cheese-like discharge, which is scanty. pH of the discharge is 4 to 4.5. Sexual transmission may or may not be present, so the treatment of the partner is done only if the symptoms are present. Investigation of choice for candidiasis is saline microscopy, where we see pseudohyphae in KOH staging or spores. Pap smear. In pap smear, the hyphae are identified and the spores are smaller than the nucleus of the epithelial cell, and here the hyphae with the spores are seen as seek kebab appearance in candidiasis. The gold standard investigation is culture. Treatment is fluconazole 150 milligrams oral stat is given, and in pregnancy we can give oral azole. In pregnancy oral azoles cannot be given, so in such case we can give topical miconazole, topical miconazole or cotrimazole can be given. So in pregnancy oral azoles are not given, so we can give topical miconazole or clotrimazole can be given.
thank you and thank you for watching.